Hey guys, Kevin from Crowncraft here. I'm a licensed pharmacist, and today I wanted to react and talk a little bit about this website somebody showed me. It's called locklab.co. In case you weren't aware, it's a direct-to-consumer hair restoration service similar to Hims. And a little bit about them is I think they're all quite similar. You just log on, fill out a questionnaire, then you get on a quick call with a doctor or other healthcare provider. Sometimes it's just a chat. And they ask you a few questions, and then they prescribe you some medications that they have on offer for hair loss. They're usually very convenient, easy to access, and depending on the service, fairly inexpensive. They've become pretty popular in the last couple of years for various different services. And this one is specifically for hair loss. So I thought I'd just go through this website and talk a little bit about it. I have absolutely no affiliation with them whatsoever, and I don't really have any opinions as of now, good or bad. So, we'll just kind of dive right in. So looking at this website here, they make this claim. LockLab is a once daily pill that's 97% effective at stopping hair loss and 90% effective at improving hair coverage in men. That's a pretty bold claim. I think for finasteride alone in some of the clinical trials, they saw about 80% of men had some regrowth, at least in some of the studies I've seen. In the larger Japanese trials, they've seen maybe 90% of men at least didn't lose any ground. And I think this combines three different medications: Minoxidil, Finasteride, and Biotin. So I don't know where they got these numbers from, but I would say it's fairly close to reality. So I don't have any issues with that. Well, all right. So what makes the perfect hair pill? Let's get into the meat and potatoes. So it's three ingredients. They have a high grade finasteride as opposed to low grade like you and I are getting. Actually, finasteride is just finasteride, right? Like it's either it's there or it's not. There's really no differentiation between them. It's not like a pizza where there's good and bad quality. Well, here, I think this is kind of telling. LockLab versus others. Our third-party tested 1.1 milligram is a more effective dose than the 1 milligram you'll find elsewhere. So I got to stop here and comment on this. Is it technically true that 1.1 milligram is more potent than 1 milligram? Yes, but is it clinically relevant? In my opinion, no. I mean, you have some dose ranging studies that I've talked about before in my other finasteride video where they looked at different dosages of finasteride, and that study suggests that even a 0.2 milligram dose is almost as effective as 1 milligram. In fact, 0.5 was quite effective as well and almost reached the same efficacy as 1 milligram. You could argue even half a milligram is totally sufficient for most people. So 1 is a standard dose. There's nothing wrong with that, 1 milligram, but 1.1 and calling this more effective, I think it's a little bit disingenuous and it's a little bit of a stretch. The two things actually you should know about medication dosing in general: there are regulations that brand and generic drug manufacturers have to adhere to in the United States that regulate how much deviation they can have when they make a pharmaceutical product, a medication. So for example, if I am a drug company and I make a pill that's supposed to be 100 milligrams and the FDA comes in and does an analysis on what's actually in those pills, I'm allowed to have a deviation of plus minus 10%. So any particular pill can vary by as much as 10% above or below. So if you look at a standard pill from your pharmacy of finasteride, 1 milligram, that pill is allowed to have a deviation of 0.9 milligrams all the way up to 1.1. So what difference is this pill really? Hard to say. And in reality, that deviation is actually much tighter from most generic and branded manufacturers. It's just that FDA allows a bit more leeway. Another thing you should know is this is a compounded product, right? You won't actually find this particular combination of drugs in any one pill. It's made by this company and by a compounding pharmacy, actually. Now, I don't know the specifics of what manufacturer they went to and what the organization is like, but it is true that compounding pharmacies, the deviation in their medication is held to a lower standard than a generic or branded drug manufacturer. The FDA understands that the compounding pharmacy is usually a small operation, and they don't have the equipment and the time and resources to devote to extremely rigorous and consistent assembly line and large batch manufacturing. So they give them a lower standard to adhere to so they could actually do business and operate. So, taking that into mind, I don't know if this 1.1 milligram is actually a meaningful difference, long story short. So let's move on to their minoxidil component. They say they have a high-grade minoxidil as well, 5 milligrams. And it says that Locklab versus others, Locklab's minoxidil is 60% more effective than topicals and 35% more effective than generics. And there's a little asterisk there. I think there's probably another piece somewhere else that talks about this. Let's check that out before I come back to this Biotin. Once again, 1.1 milligram has been found by Dr. Dan McGarf to be a slightly more effective dose than generic 1 milligram while still minimizing side effects. One of those technicalities. Locklab versus others, studies have shown that 5 milligrams of oral minoxidil is nearly 100% effective at increasing hair count, a 35% increase over the generic 2.5 milligram you'll find elsewhere. Let's see what the source is. Let's me briefly take a look at this. Enjoying the video so far? Well, please hit subscribe. It's the most evidence-based way to keep the hair on my head from falling out. Thank you. All right, I'm back. I just had to pause for a moment. I wanted to kind of breeze through the 2 studies that they referenced. And there's already a few things that jump out to me here. So they cited these 2 studies, and we'll take a quick look at them. Basically, they gave about 30 men 5 milligrams oral minoxidil once daily for 24 weeks, and then looked at their hair counts. And they say, look, it's a very effective treatment. 100% of men had results. And they even make a claim in this study that it's superior to any other form of hair regrowth treatment. And they cite this study, right? Comparison of oral minoxidil with other standard medical treatments. They say, look, it's 100%. And look at these numbers. They're way better than these numbers. And, the foam minoxidil in the solution, it's superior. But you got to look at how many subjects were in this study, right? They only looked at 30 people. Look at these other studies. There's 10 times the applicants. Look, there's 300, almost 400 patients, almost 700, 200, 150. It's not really a fair comparison to say that 100% of your subjects had a great result, therefore it's superior option. I'm sure this number would drop if you started enrolling 100 people, 200 people, 300 people. When you have this few number of study participants, it's often that your study is not robust enough, or what we call well-powered, in order to actually determine what sort of true result you'll get when you study this in a large population, right? You can think of it as, hey, I had 3 friends that went to the casino and they all won money after a weekend of gambling. That means they were 100% successful. If you go to the casino, you'll 100% win money based on these results of my 3 friends. This is the same leap of faith that they're doing here. And just a small comment also, they did note that even in this small cohort of patients, that they had side effects from oral minoxidil. And that was the first thing that jumped out to me, right? 93% of patients had hypertrichosis, which is just excessive body hair throughout the entire body, and pedal edema, which is basically swelling in the feet. And that's the main problem with oral minoxidil. That's why people mostly use the topical form. When you take it orally, yes, it is much more effective than the foam or the gel, but you're exposing your entire body to these drugs' effects systemically, meaning it's not localized to your scalp, and it can cause a bunch of other side effects. In fact, minoxidil was originally used for hypertension, high blood pressure, and it was kind of fallen out of favor because people had all these other side effects, mainly cardiac side effects, fluid retention, which is like this pedal edema here, and also the hair growth that was unsightly, right? These are just things that you should be aware of. In fact, let's see if I can find it. There's this sentence: reviewing cardiac monitoring, abnormal EKG findings were found in 6 patients, 20%, 2 of whom had premature ventricular contraction and 4 had new T-wave inversion without any symptoms. That's a little concerning, right? And they only found this in a very small cohort of 30 patients only. They saw 6 patients, 20% had abnormal EKG findings. So does that mean that everyone who uses oral minoxidil is going to be poisoned? No, but it's something to really keep in mind. And I think that they didn't really mention this when they tried to promote their 5 milligrams of oral minoxidil. In fact, many times people who use oral minoxidil stay at a very low dose, maybe half a tablet, which would be 1 tablet's 2.5 milligrams is what's commonly found in the pharmacy, and people will split that in half and take half. That's just one way that some patients may use it. This is not a recommendation. This is not medical advice, but that might have a lower risk of side effects than blasting people with 5 milligrams. You might still have the same hair growth benefits, right? This minoxidil is a bit of a high risk, high reward medication. The more aggressive you're dosing, the more likely it's going to work. That does appear to be true based on the studies that we have available. But there is a reason why the topical gels and foams are so popular. They're just a bit safer from a cardiac perspective, which I think is quite important to know. And finally, the last thing, biotin. Oh, man. Okay, biotin for hair loss. Oral biotin, 1 milligram. LockLab versus others. LockLab packs in a solid 1 milligram of third-party tested biotin for increased hair thickness versus only 0.3 milligrams in most gummies. What a slam dunk. Not really. Okay, I'm just going to be straight with you here. Based on our large body of evidence, biotin is not a good treatment for male pattern hair loss and most hair loss in general. Is it true that it is a vital ingredient for healthy hair and hair growth? Yes, it absolutely is. But it only has any benefit when you're deficient, which is actually very uncommon in most Western societies. You actually only need 30 micrograms of biotin a day. 1 milligram is 1,000 micrograms, just to put it in perspective. Most people's diets, just your normal diet, you take in anywhere from 80 to 100 micrograms a day in a typical, let's just say, Western diet. So most people are totally replete with biotin. They have enough. So taking a biotin supplement, it's not harmful in most scenarios, but it's unlikely to be beneficial for hair. There are a few exceptions. For example, if you're actually biotin deficient, if you have certain genetic disorders which don't allow you to absorb biotin, or you're taking certain medications that can lower your absorption of biotin. Those would be scenarios where biotin could be a good supplement to add on. But to kind of promote it as a must-have is, I think, a bit of a stretch. It's not hurting anything. but it's unlikely to be helping. I guess you could say your bases are covered here, but it's almost like they try to promote this as this ultimate trifecta, and that's not really the case. I'm just looking around. Okay, this is kind of interesting. They also offer the same combination plus dutasteride. So this I actually like. Oral dutasteride, 0.1 milligrams. Dutasteride is another 5-alpha reductase inhibitor, similar to finasteride. And it actually blocks 2 forms of this enzyme that finasteride doesn't block. So you might get a little bit more DHT lowering effect from dutasteride and get a little bit more hair regrowth with that. So I think that this is a pretty legit combo. Some people will not see any benefit because finasteride was enough, but if you're a non-responder, this could be beneficial. Okay, so not seeing regrowth with topicals. Half of the men can't biologically absorb them. Research shows 50-60% of men don't have enough of the enzyme required to absorb topical minoxidil adequately through the scalp. That's not actually technically true. What they really mean is there's an enzyme, actually a sulfosyltransferase enzyme inside your scalp that is responsible for converting minoxidil into its active form, minoxidil sulfate. And some people don't have enough of that enzyme. So minoxidil is actually getting into your scalp, but it's not getting turned into the active form. But they may have simplified this for like a lay audience, right? Transplants are usually temporary unless accompanied with medication. I actually do agree with this point here. I can get into that at a later point, but I would say that that's fairly true. I would say this statement, it's a lie that your topical spray works just as well when used once a day. So it's probably better for minoxidil sprays to be used twice a day. So they are correct. You know, this is true. So it's another misconception. Dead follicles cannot be revived, but bald areas can be regrown. This statement is true. Follicles can still be alive underneath the surface of your hair, but they're just very, very tiny and very miniaturized. So with the proper treatment, they can regrow back to their youthful self. See here. So, oh, okay. Here, interesting. All right. So looks like they offer like a customized dosing as well. So in summary, I think Lock Lab does do like a pretty good job. There's a few silly things here inside their formulations, but overall, would I say this is ineffective? Probably not. I would say that your average person will get pretty good results from this combination. What I don't really like is this sort of cookie cutter dosage of finasteride and oral minoxidil, especially. You could be exposed to side effects that they don't really talk about very much. There's this small, tiny bit. Side effects are rare, but safety first, gentlemen. This tiny line that they kind of glaze over. And I think that people should be well informed before starting the medication, and they keep this a little bit de-emphasized. So I think for the general person, your Joe Schmo, this is a great option. $35 a month is pretty affordable, and it's very convenient, right? It's just a pill you take once a day. There is a reason why most medications you'll find in the pharmacy are not combined typically, because it's hard to predict your own personal reaction and tolerance to different medicines. Some people may do just fine on minoxidil 5 milligrams a day. Other people may have cardiac side effects. You may need a lower dose. Maybe you don't tolerate the tablet at all and you need to use topicals. So there's all this customization they don't offer, at least off the bat. Seems like you could do that here for an additional price, $45. They might tailor a prescription to your needs. I think that this is a great option. I do like this. Overall, I'd say I'd give them like a B. A few caveats here, but overall good service. If you like this kind of reaction and a little breakdown, subscribe to my channel. I'll be doing more of these and talking a bit more about hair loss. And if you have any other questions for me, just drop a comment down below, and would appreciate you liking this video if you got a little bit of entertainment out of it or got a little value out of that. It really helps me out a lot. All right, Kevin out. See ya.